Thank you for being here at the Institute for Spirituality and Health. This is about our third in a series of talks that are on spirituality and healthcare. This one is entitled Suffering, Spirituality and Healthcare. And we have completed about half of the talks that we're going to give this fall. Dr. Ferdos completed his series on world religions. We've had 3 of these talks and now this one on suffering, spirituality, and healthcare. I'm going to cover a lot of material, but rather than us go down this whole list, let's just go ahead and get started. There are a number of books that have informed me on my understanding of suffering, spirituality, and particularly The Healer's Calling is a very interesting book that has a nice chapter. Also, if you will, Christine Longer's book on facing death and finding hope, as well as Harold Kushner's wonderful book, When Bad Things Happen to Good People. And we're going to look at that at the very end for a moment. There are those that say really the only proper human response to suffering is to relieve it, get after it. And otherwise, if we can't relieve it, just to remain silent. I think that's probably not true. People who suffer, it is said, want their relief. They don't want lectures. That's true. However, clinicians know that relief is not always possible, and consolation is not always apparent. And that being true, just to have mute silence as the only response to suffering is really not sufficient. The issue of suffering is unavoidable in any discussion of spirituality and healthcare because it's so prevalent. And so that's what we're going to be looking at, and I think we'll have I believe, and any feedback I can get from you I would appreciate as well. All who care for the sick see human suffering every day and must deal with it. There was a really fascinating article on the front page of Houston Chronicle last Sunday, maybe it was 10 days ago, and it was entitled, L is for Life, Love, and Loss. It's talking about teachers who teach ill children at Texas Children's Hospital, and I want to focus on the fact that this title says, Teachers are tested by hope and sorrow, because it really is a powerful challenge to any human being to deal with suffering as they do. And in this wonderful story, just really enriching story that tells about a teacher who relates to a number of children, and then at the very end, one of her children suddenly dies, and the impact upon her. So it's certainly something we have to deal with when we're talking about healthcare. Those who reflect on care that they are giving to patients will want to seek to find meaning in the suffering that their patients must experience. It's certainly human nature to ponder the question of life and death and engage in a soul-searching for answers in a deep soul-searching way. And yet many professionals really refuse to engage the question of suffering. They dismiss it or may say, well, it's not my area of expertise, it's not my training, so they don't engage in it. And when you don't do that, usually what you do is you abandon your patient. And that's been a long-standing tradition in medicine, which is improving, but through palliative care and through classes like this and others where we talk about suffering and the fact that there is something that we can do and not just have silence and then walk out of the room and leave our patient where they are. We all have probably heard of the theodicy question in theology, which says, why would a loving God permit human suffering? But I want to say up front, that's not really what I'm going to talk about. I'm not going to try to answer that question. We might can talk about it later if you like. But really what I'm talking about is a spiritual reflection on human suffering as it occurs in the practice of healthcare professionals. It's been said if suffering does not have spiritual meaning, then no spirituality of healthcare is possible. Think about that. If suffering has no spiritual meaning, if we just suffer and that's it, then we might as well not even talk about spirituality in healthcare at all, because this is such a central aspect of patient care. Suffering should be distinguished from pain, however. Not all pain causes suffering, and one can suffer without physical pain. Of course, as you know, there's mental suffering, there's emotional suffering, going through divorce or other tragedies, loss of a job, and there is spiritual suffering. And spiritual suffering may be going right along with the illness. In other words, asking God, why in the world am I sick? What's going on? Why did you let this happen? What have I done wrong? Those kind of questions are a part of what is called spiritual suffering. Pain itself, though, is a physiological phenomenon. It results from stimulation of pain receptors that send signals, of course, to the brain through nerve fibers. There are really three origins of pain signals sent to the brain. There's the somatic nerve fibers coming from skin and joints and areas in that area. There's the deep visceral pain that comes from body cavities. And then there's neurogenic pain from injury to nerves themselves. And we classify pain as either being acute or chronic by how long the length of the pain itself. It is known that some ethnic groups differ in how they experience identical pain. We probably, I'm not going to label any ethnic groups, but when I was in medicine, we were in the OB, delivering babies. There was clearly different reaction from different ethnic groups, and we recognized it and talked about it. That's just a part of, I guess, the cultural makeup of people. We can't judge it, but it is true. And if people suffer greatly with their pain, then we need to honor that. Pain signals undergo also an intense cognitive processing in the brain. We know that from functional MRI studies that the whole brain is engaged, and including memory areas and so forth. So it's quite a process. And we classify our own pain in a lot of different ways. We may ask, or a doctor may ask, or a nurse may ask, is it sharp, dull? Give me an idea of what you're experiencing. And we list those things. We can say it's a burning pain, aching pain, boring pain, pressure, gnawing, and cramping. Gives us some idea. And certainly maybe the origin would make a difference. For instance, if it was a deep visceral type of pain, we may experience it differently. And then also whether it's acute or chronic. If it's an acute pain, we deal with it quite differently than if chronic pain that we just think this is never going to go away. That can create an enormous difference in how we will process it in our brain and how we'll address it. Suffering has less to do with the stimulation of pain fibers than it does with the overall felt experience we're going through. It's bigger or wider than pain itself. Suffering is experienced in relation to one's situation in life. One can experience pain, as I've said, without suffering. In fact, the athletes, they brag about it. If you don't have pain, then you're not going to be able to gain in athletic endeavors. Marital discord causes suffering, and suffering is wider than pain, sickness, even death itself. It's greater in its impact on a whole family unit. Pope John Paul said this: what we express by the word suffering seems to be particularly essential to the nature of what it is to be a human being. So when we talk about suffering, we're talking about different than pain. I've made that distinction, I think. And it is also very much a part of what it means to be human. And that's the significant point we're going to make. If suffering has more to do with nature of being human than it does with pain alone, it follows that one must understand what it means to be human in order to understand what it means to suffer. I hope that makes sense. Our suffering is really part of a mystery. It could be said that the mystery is as deep as what it means to be human. And if you think being human is not a mystery, you probably haven't explored yourself lately. Being who we are, being, for that matter, the transcendent God is a mystery, and we are a mystery as well. We're a mystery to ourselves quite often, and we certainly are a mystery to our spouses, our children, and everybody else that has to deal with us. It's highly unlikely that neuroscience, though, is going to find some sort of track for a suffering brain or be able to find an area that's exclusively tied to suffering. They've studied it long enough that's not likely to be the case. The brain has pain fibers, pain centers rather, but not a suffering center. It's sort of a global event in which we even use everything from the frontal lobe to include our memory sections of our brain. It could be said, therefore, that suffering is not limited to the brain. Now, neuroscientists, many of them have reduced the mind to the brain, and I don't concur with that. There's a wonderful book about this thick called The Irreducible Mind, meaning you cannot reduce it to the brain alone. And the temptation, I think, was with functional MRI studies, as we started watching all that was going on, we thought, well, look, it's all right here before us. But that doesn't really necessarily say that we don't have a mind, that we don't have something a little more transcendent, if you will, than our brain fibers themselves, just the brain itself. I believe that it isn't. Well, what does it mean to be human? There's a physician, internist at Cornell University, Eric Castle, who defined humanity. What it means to be human, he said, you had to have these necessary characteristics of personhood. He said memory, relationships, personality, awareness of the future, and being oriented to the transcendent. These were, of course, his views, but the only problem with this is, what if I lose my memory? I'm amnesic. Does that mean I'm not a human anymore? I don't think so. So really, it's very hard to come up with a short list of what it means to be human. I think some of those that he's listed are very important. I'm going to mention two of them in a second, but I think the uniqueness of the human personality, I think the ability to ponder the future are all significant. But the principal two things that I would say are important are to being human is, first of all, our orientation towards the transcendent God, and I want to look at that. And then being human means being in relationship. Personhood is very definitely associated with relationship, and the idea, the concept that we have some sort of orientation that here's the way it would be understood, I think, by me, is that we are spiritual beings. And because we're spiritual beings, we respond to spiritual presence that is transcendent to us, and many of us put the name God on it. We really cannot lose these two characteristics, and that's the point I want to make. If these are real, if they're part of what it means to be human, you can lose your memory, but you cannot lose your relationship with a transcendent God, your orientation towards Him. There I go. Excuse me. I'm going to try a cough drop. Maybe that'll help. You cannot lose that relationship because that relationship is really God-oriented. It's God-given. It's a relationship that has already been established, and we can't lose it. We can lose our memory, we can lose our talents, gifts, money, hopes, dreams, but we cannot lose that relationship. Now, the orientation towards the transcendent God and being in relationship with God is really saying the same thing. It's two phenomena that are like a coin, both sides of the coin. Relationship with the transcendent is a given, is my idea, because conscious awareness of this relationship is not necessary. Many people will deny it, say that it doesn't happen. But just because I deny it doesn't mean that it is not, and because I haven't experienced, doesn't mean that it's not real. In other words, if many others throughout humanity have experienced it, they understand that relationship with the transcendent, then we cannot deny their experience. It's a part of what it means to be human. So the experience of the transcendent comes to human beings through our intellect. And by the way, it comes in many different ways, and I think it depends a lot on our personality. Thomas Aquinas, said to be one of the most brilliant men in all of human history, and I think he probably was. If you're an intellectual sort, you may love to read all of his essays and his writings. But it may be that the moral issues may bring to your mind, why are human beings ever moral? Quite frankly, we're close to the chimpanzee race, species. We're close to gorillas. We're pretty violent. They're not sweet and nice. There have been a lot of studies that show that. And it appears that though that we have something else, we have a characteristic that leads us to moral behavior and caring about others. Otherwise, we wouldn't care about anybody, but we do. And we have aesthetic experiences, and I'm going to look at that in a second, with beauty and that touches our heart in a deeper way and often leads us to an experience with God. And then we have religious practices that are very explicit. These could be worship, prayer, could be meditation, contemplation, and the list could be very, very long. Those practices that we would encounter in a religious setting. All of these invite us to have the opportunity to have an experience with a transcendent God. Now, the reason I can tell you that is I've had an experience with a God that turned me upside down when I was 35 years old. Prior to that, I would have denied it. In fact, I did. I had an Episcopalian sister-in-law that came to me and would talk about God and healing, and she would say, we prayed for people, for so-and-so, and she was healed. And I would slam my fist on the table and say, show me the x-ray, show me the lab results, I don't believe it. And I tried to humiliate her, and she wouldn't disappear in my life. But when I was about 35, I literally had that experience that turned my life upside down, and it hasn't stopped yet. And I know it's real, I know it's genuine, and I can't prove it to you, but I know what I've experienced, and I'm not alone. I mean, it's the history of humanity is having encounters with the living God by many, many of us. Not all of us, of course, but many. So we can't deny it. There's an aspect of being human that causes us to want to seek the beautiful. If you've ever been to see Michelangelo's magnificent statue of David, you know what beauty is. I mean, it is spellbinding to walk into that space and to stand at, it looks small in this picture, but it's towering over you. And Michelangelo took just a sort of discarded piece of marble and was able to create this amazing figure. But we understand that. We create symphonies. We create beautiful works of art. We create sculpture that we are seeking for the ultimate. We're seeking for the ultimate that can be found in what is beautiful. And experience of the ultimate can be ways that we experience the transcendent God. Genuine religious experience maybe had either through a direct experience with God, or it can be one of those things I've already mentioned. But all of them, whether it's intellect, moral, aesthetic experiences, they culminate, the principal idea is God is greater than all that we could conceive or imagine. God is that beautiful, more marvelous than anything we could imagine. So all of it points to there must be something greater than this carcass, something greater than me, something greater than this table, that there has to be something out there, and many of us feel we have experienced it. We may deny the experience of God, but we cannot, I think, deny the experience that there must be something that's ultimate, that we can reach for. Humanity and relationship. In Judeo-Christian thought, every human being is created in the image and likeness of God. So if we're talking about where we find meaning, then it's in that relationship. Human beings are defined by that relationship, and it gives us dignity. Every single human being, even the guy under the bridge, the reprobate that life seems to have given up, he's given up on life itself, even him. For human beings to be real is to be in relationship with God. And God is to be seen as a heavenly Father, and all other human beings as brothers and sisters, equally children of God. And that is a transforming thought. And if we rightly understand our religions, they don't exclude, they include. I love what Judaism's idea was. We're special, called apart people, but we're not called apart because we're special. We're called apart to tell everybody that God loves everyone. We're the messenger of the message. And I think that is what all religions should be like. We should not be saying we have the exclusive right to who are the children of God, because we should, in fact, be saying all are the children of God. They're all my brothers and sisters. And we cannot ignore this relationship in ourselves and in others, but that does not mean that we can ignore the relationship in ourselves and others, but does not mean that the relationship does not exist. Suffering and finitude. Now I'm getting back to suffering. We've talked about the meaning of where we get meaning as a human being, at least I think from my perspective. And what I want to say is that all suffering may be understood at its root in the experience of finitude. In other words, we're limited. And because all human beings are oriented to the infinite, transcendent God, we're aware of what it means to be radically limited and experience finitude. So we know there's something missing. We know we haven't got it. But we know also that there must be something there that does, and that's the transcendent God. We cannot escape the fact that our nature is fallible, that we're prone to make choices that lead to pain, distrust, deception with the very ones we love. We're oriented towards the beautiful, and yet we wind up aging and not looking so beautiful as we get older, if we ever did look beautiful. In other words, we humans are oriented towards the infinite, and yet we live in a world that is finite. Our lives are marked by death, and some make choices that even lead to the death of others. That's the human reality. So suffering is a part of what it means to be human. Suffering is the experience we have of knowing ourselves as these finite creatures who've been given the gift of freedom to create wonderful and marvelous, beautiful things, but also the freedom to destroy. And we're subject to suffering every time we make a choice, because to choose means we must give up something. The point is, every free choice we make is a reminder of our finitude, that we can't do all things, and to be reminded of our finitude is to suffer. I don't know if y'all are like me, but I look back over my life, I've done a lot of different things, but I also know there were a bunch of things I could have done that I didn't do, and I wish I had done. One of them is I wish I had had piano lessons when I was young. I really do. Every time I go to a party or somebody and there's a guy just sitting there and just came out of the group and starts playing the piano, I wish I'd done that. Somebody keeps reminding me every time I say this, you still can do it. But there's so many, we're so creative, and we have so many talents and gifts and possibilities. They're all out there. And yet we can only do a few very well, at least. We have to focus, it seems. And in a way, missing the things we missed points up our finitude and our suffering. You may think I don't suffer because I hadn't played the piano. I think I did. I do. I think I do a bit. I played a trumpet, but that didn't work. You have to carry a trumpet around all the time. You know, it doesn't work. But the piano I'd like to have done. We're also susceptible to suffering whenever we experience pain, because pain lets us know how fragile we are. And it makes us aware of the threat of our existence. Now, pain doesn't always cause suffering, but it can. The toothache, we probably know if we get to the dentist quick enough, we're going to get it solved. We don't, well, we're suffering while it's hurting, but it's going to be short-lived. We don't worry about it like that. But when we do experience pain that is chronic, we may think this is never going away, and it's going to affect my existence. I won't be able to do things. If you have back pain, I won't be able to play golf maybe, or maybe it will even affect your work. So chronic pain has a way of engendering worse suffering than the acute pain, because it's this constant reminder of our finitude, constant reminder of what's going wrong with us. So every pain is a reminder of finitude, and to be reminded of our finitude is to suffer. Can y'all repeat the last little phrase there after and? To be reminded of our finitude is to suffer. I want to hear y'all chorus it though. And to be reminded of our finitude is to suffer. I'm going to look at that a few times, and every time I get to it, I want y'all to join with me, because I believe this is significant about what suffering, how it comes about and what's going on, and we're going to look at some different things. We're also susceptible to suffering whenever our choices are constrained or controlled. We have choices that are somebody else is controlling, and it reminds us of our dependency on others. Maybe it shouldn't be. Many forms of injustice happen, and we're aware of it, so we are frustrated. We wind up suffering. To be under control of others are natural processes like the hurricane that hit New York. Beyond our control, can't do anything about it. Our finitude is prevalent, is brought to mind. So every choice in life that is constraining on us reminds of us of our finitude, and to be reminded of one's finitude is to suffer. We're also susceptible to suffering whenever we become ill, because it's been said that every illness has the smell of death in it. It has the smell of death, mortality, finitude. Now this upper respiratory thing I had, I don't know, I got to where I thought it never would go away because I'm going through it for 4 weeks. But a real illness, a diagnosis of cancer, certainly has the smell of death, but it doesn't have to be just that. It's any illness where we are not in control, we can't solve it, we're going to doctors, and maybe they're having trouble solving it. We may even wonder, did they really make the right diagnosis? Maybe I need a second opinion. And all of it because behind all of it is this fear that maybe there's more to this than what meets the eye. Illness imposes limits, causes pain, loss of self-control. and a healthcare provider needs to be aware of this. I tell medical students when I talk to them that there are 4 levels they ought to think of their patients. First of all, the biomedical level, because that's who they are. They need to be very well aware of, through tests, all the studies they do of what the biomedical situation is. But at the next level is the individual's life. What is the impact of this illness on their life? Can they go to work? Is their work imperiled? Next level, the third level, would be their relationships. What's happening in their household and their family because of this illness? Is the spouse having to go to work, perhaps at a very low wage or something, where he or she had not done before? And finally, the fourth area is ultimate concern. When you have an illness, if it's serious or significant, there's always the question, God, why did you let this happen to me? What did I do wrong? All kinds of questions on a spiritual level occur. And if the physician is not aware of it, or the nurse is not aware of it, and doesn't take the time to go down those layers and get to know their patient, they'll never know it happened, never know what they're experiencing. And if the patient is not known by the physician and nurse, the caregiver, then the patient feels they really don't care about me. But if asking a few open-ended questions that lead to an understanding of those 4 areas, the patients always feel, this doctor cares, this nurse cares. I've been well cared for. I'm glad I came to this hospital. So it's very important. To be ill is to remind one of one's finitude, and to, let's do it together, to be reminded of one's finitude is to suffer. Suffering of the sick and dying are perhaps the most basic form of suffering. The word patient comes from the Latin word patens, and it means one who suffers. That's logical. But we often don't think of that when we say, I have a patient, if we're a medical doctor or we're talking, hospital setting. We talk about a patient, but we don't realize the word itself means one who suffers. So it ought to bring that to our awareness. Finitude is the message, in other words, that we're limited, that we're fragile human beings, and the illness is the messenger of that reality. We can be deluded most of the time of our life, and it is a delusion to think we're not fragile, to think we will live forever. Young people think that. Those delusions may safeguard us from, we think, from suffering, but they also are deceiving. I think the Buddhists, I think, have a wonderful idea of saying all suffer. The beginning of their principle is that. And it helps bring that to a conscious awareness so that we can deal with it. And at any rate, the illness itself is a messenger that's telling us we're a finite being. Understanding this should help a physician, a nurse, healthcare professionals care for their patients. So how can they do it? I'm going to look at 3 different ways that it can help our understanding. It can help us not be judgmental, where the caregiver may think the patient is exaggerating their symptoms. And I want to tell you, 40 years ago when I was doing OB, we thought certain ethnic groups were exaggerating. We'd look at one going through the same thing. They weren't yelling. And then next bed, someone yelling. We were very judgmental. We didn't understand it. The example I want to talk about is whether a patient is experiencing back pain due to the protruding disc, caught in a grip of depression, or one who has metastatic cancer. All are being reminded every day that his or her life of death is coming. It's the messenger of our finitude. Whether caused by the disc or caused by depression, cancer, patient is facing finitude, and it evokes in every patient the mystery of death that may await them. So we can avoid thinking about it, but we will be surprised when it happens, and it can happen when we have an illness. But to say that a person's suffering is a mystery is not very helpful. The mystery of suffering can only be understood in terms of the mystery of being human. That is helpful to understand it. Being human inevitably means being in the relationship of a transcendent God, God where all things are possible, being oriented to this transcendent God and at the same time possessing the knowledge of one's own radical incompleteness and finitude. That's what it means to be human. I want to mention something that the third thing that's helpful in understanding here. I once heard someone tell about intrinsic and attributed values. That you and I have attributed values from the day we're 2 years old on, well, maybe even before that, but whatever we do, our doings, if you will, our culture responds to us as wonderful, you're doing great, you have all this talent, you do so-and-so, we get a degree when we get out of college, or a PhD when we go to university. We get positions, titles. These are all kind of, if you will, given to us. They're attributed to us because of what we have accomplished. They may tell us how intelligent we are, artistic, gifted, funny, and we get promotions at work, honors, and all this sort of stuff, and all looks wonderful, doesn't it? Those are attributed values. And then there is intrinsic value about being, if you will. It comes from being human and therefore related to the transcendent God. Now what happens is, as you get older, your attributed values start disappearing. Your BS degree or your PhD may not mean much once you've retired. You lose your position, your title. I was talking to a general who had just this past week at a banquet thing, and he had been general of some. He didn't even want to talk about it. His friend who was sitting in the next chair would say, he won't tell you but so-and-so, and he would tell me all this stuff. You know, it was like, that's not even part of my life anymore. It's gone. All of the recognition he once had and the promotions that he got are meaningless for him anymore. And we become, if we are counting on our attributed values to say who I am, I'm going to be in real trouble if I either get ill or handicapped or aged at the end of life, near the end of my life. So, and nobody's around there telling us about our intrinsic value, do they? I mean, we don't think to do it. We ought to, but I think a physician, nurse, or a health care giver could just be conscious of this. The intrinsic value of being human is an important thing to recognize, and whether our patient is ill, whatever they've got, and they've lost all their attributed values, they haven't lost their intrinsic value and won't lose it because of God, who they've been created in God's image and God loves them. And that's a vitally important thing to know when anyone's ill or experiences loss. I want to look at three ways a doctor, nurse, healthcare giver can respond. We all, of course, know the words sympathy, empathy, and compassion. And certainly everyone as a patient experiences symptoms. They may be suffering, and to recognize this, we ought to be sympathetic to them. Concern usually leads us, the patient, to seek a consultation with a healthcare professional, and now they become the patient. And physicians understand that patients suffer with their diseases, but understanding the physical aspects of their suffering really isn't enough. It doesn't incorporate all of the life of this person and what suffering may really represent for them. Suffering of another person, I can't really know exactly. I can know more if I talk to them. I can understand it better if I'll share with them, let them share, ask open-ended questions. It's certainly a private experience, and many men are trying to be stoic, and they turn the other way and face the wall. They don't even share it with their own spouse and family because they don't want to upset them. And certainly could be true of a woman too, but suffering is a very private experience. If you can get the confidence of the patient, you may find out the depth of it. So at the very least, we can be sympathetic. This picture is of a man, it's hard to see, he's actually screaming, it appears in pain. A whole raft of people came to help him. Sympathy is a state in which one feels the distress of another person. And that's what a nurse, doctor, and other healthcare professionals can and do. We ought to feel bad when a patient is feeling bad. In my hometown of Shreveport, Louisiana, my wife was going to a dermatologist for psoriasis. And, patches on her skin. It didn't stop her from doing any work or anything. But her dermatologist hated those patches. I'm telling you, he felt, it just got to him. And I had never seen a doctor identify with a patient's problem like Dr. Resnick did and does, I'm sure, in Shreveport, Louisiana. He understood, and immediately he said, we've got to do something, we've got to solve this. And he had a whole series of things he had her do, of course. Sympathy is a good thing, but it's not everything. There's more we can do. We can be empathetic. And empathy says to the patient, I think I can appreciate how you feel. It puts us in their shoes, so to speak. It's an attempt to understand the suffering of the patient as the patient experiences it. It's not just sympathizing with them, but it's suffering with them. And it's at least partially possible to do that. It's a step in the right direction for healthcare givers. But even empathizing with people is not quite sufficient. What we really want to do is render compassionate care. Compassionate care of healthcare professionals engages the suffering of the patient, I would think, on at least 3 levels. First of all, it recognizes the patient is suffering. Sympathy will do that. It responds to the feelings with genuine empathy for the patient, and it then moves to concrete actions. That's what Dr. Resnick, the dermatologist, was doing. He did it all 3 levels. In words and deeds, and he engaged in it, and boy, you believe he wanted to get rid of this problem. And it could be only sometimes kind words and a gentle touch. That may be all we can do, but that's an action. It may be what we should do at that appropriate moment. This would be, I guess, what we call the spirit of the Samaritanism, a spirituality that fills compassionate response that characterizes all acts of healing. If it's a true healing, it's going to be compassionate. And through compassion, the transcendent God is made manifest in the relationship between a clinician and a patient. I think, looking at Dr. Resnick, you could see what God is like. He cared, he came, he intervened, and he took actions. Well, what would life be without suffering? John Hick is a theologian, and he asked us to imagine a world without suffering. Imagine a world where you felt no pain if you were shot by a gun or run over by a car, then nothing hurt. And he said, such a world would not be the one that we know and live in. It would be something totally different because we would never be in any danger. There would never be a need for anybody to rescue us or for you to help anybody else. It would be a strange world, really. He says good and evil would cease to be categories to be whereby we measure human behavior. He says mercy would have no meaning. Justice would have no point. Relationships would not matter. Hick says that there would be no love without suffering, because suffering engenders that compassionate response, and compassion is so tied with what it means to love. We don't have a direct therapy for suffering unless it was coming from pain and we can solve that, but there are no real pills exactly that will treat suffering. Suffering is not a symptom as such. It's part of that mystery of being human. And although healthcare professionals have no direct therapy for suffering, they can respond with compassion towards the person that is suffering. And to be compassionately present is to be fully human. That's who we ought to be. We can only transcend our finitude by reaching out and actively beyond the limits of my limited existence and touch the infinitude of a fellow finite creature. When we touch him and his need, we transcend ourself and become a part of that transcendent God, I think. When we're compassionate, we transcend our own finitude and reach the infinitude of the suffering other. This is where the infinite orientation of our humanity points towards the limitless, compassionate love that is God. Compassion is a manifestation of love, and love, whatever else it may be, involves choices. In order to love, it's one of the true sources of freedom that we have in the midst of human suffering. Choosing between options is a condition of freedom in our finitude. Every free choice involves suffering, though. To say yes to love involves saying no to something else. One cannot be charitable to another without giving something, either of your own time, your own money, or something else that you have. And don't think that it doesn't cost. It may cost because of your engagement in the suffering of this other person. It may lead you at the end of the day feeling weary, but it also allows you to know what love is all about. And this is the paradox of compassionate love. It's making the choice to love and face suffering and the finitude that love requires, while one transcends that finitude and embraces freedom of boundless love which is in God. I think we're called to compassionate care, and when we're called to that, I think we become more like the God that we want to serve. God does not want everyone to suffer for the sake of suffering, but as long as we're human, we probably will suffer. And by the way, I've been serving in one of the largest Episcopal churches in the United States and some of the finest people you could ever imagine. I want to tell you there's probably not a single household that has not experienced suffering. Some of the finest people you could ever imagine. Pillars, they all look great on Sunday morning, scrubbed up. Oh, they're wonderful. Ask them how they are, fine. But I want to tell you, they great, loving people may have a bipolar son or daughter, and not a single day goes by they're not suffering with that for him. Families that go through divorce that are bloody and never ending. It's, like death would be better, but this doesn't end. On and on and on. Illness, leukemia, breast cancer. Just when they feel like they've got it all made, got all the money you need in the world, and you get cancer. Or your loved one, your child is in the hospital. One of the recent ones that I heard had a little girl that has osteogenic sarcoma of the leg, So we all are going to suffer. So don't think you can escape. It's an illusion to think that. It's not a test from God. It's only the embracing of our human condition that makes us suffer. And it's the choice we have to love. Love calls forth compassionate responses to the suffering of others, and only choices that are made in love can transcend the suffering. Treating diseases and symptoms is not enough for a healthcare giver. Suffering is not a disease, or really a symptom. cannot be cured by a pill or a tablet. Suffering is only healed by compassionate love, and I want to make that my statement. Healthcare givers are called to be good Samaritans, to heal with the oil of compassion. That's how we do it. Healthcare givers are also called to be humble and to realize medicine doesn't have all the answers, believe it or not. It doesn't have, and by the way, the stuff I was taught 40 years ago in med school probably isn't worth a hill of beans today. Well, it might have been a foundation to build on, but 40 years from now, and what they're teaching our med schools right now, 40 years from now won't be valid then either. Medicine is not the end result of the perfect answer for healing, of course. It's a process that we continue year after year of hopefully being better. Medicine can do much to treat pain, but that's not perfect either. And every now and then I hear a clinician say to a patient, I've heard this, don't worry, you're hurting with cancer. We're going to send you to palliative care, and palliative care knows how to manage all pain. You'll be pain-free. It's not true. I know because I go to palliative care conferences, and as high as 40% at MD Anderson Palliative Care have pain that's not touched by the drugs or medications that they're given. And it's a puzzling thing. It's probably a part also of this huge envelope of suffering that's around pain. In other words, we know if you suffer, your pain will be made worse. So if it's not always being addressed, and nowhere is it being addressed better, to be honest, probably than palliative care at MD Anderson. But nevertheless, we shouldn't be deceived into thinking all pain can be relieved by medications. We experience feelings as humans of fear, loneliness, helplessness, abandonment, which often follow all aspects of suffering that morphine cannot reach. You can have that IV in there and push the button every few minutes, but you may still, the minute you come out of it, you're in the feelings of fear, loneliness, helplessness, and abandonment. Nonetheless, I believe healthcare professionals can still be healers in the situations that are dominated by suffering. They can do it if they learn and understand how to manage suffering itself. It consists of acknowledging the reality of suffering, having expressions of empathy and compassion, and what I call a silent presence, not abandoning the patient, not rushing out of the room, but being present for the patient. And in the process of reminding the patient that he or she still, no matter what, has intrinsic value. There's dignity, meaning, and value just to them being human, and even in the midst of their dependency and their fear. Again, genuine healing requires compassion. Only from compassion can we touch the infinite in the suffering of the other person. I want to look very briefly at religions and how they approach suffering. Judaism says suffering is from human sin. They also talk about the suffering servant motif, which is the Jewish community itself, that it's a suffering servant in this world, working to build a world community of respect, compassion, and caring for one another, and above all, for a world of peace. And how wonderful it would be if we all did that. All religions did that all the time. Christianity, suffering also as a result of human sin. But even Jesus did not escape suffering. Christ reached out to the sick, suffering with compassion and a healing touch, and we're to do the same. Islam, suffering is the result of sin. In Islam, though, sin is associated more with unbelief, and Muslims surrender to God's will 5 times a day and find peace in that surrender. Hinduism, I mentioned, suffering is due to karma from former life. To live a good life now in the reincarnation. You'll have a better life. Buddhism says all suffer due to attachments. There's a way out. There are 4 noble truths in the Eightfold Path. And finally, Harold Kushner. I think we have a moment here. I want to remind ourselves of what he said in his great book, When Bad Things Happen to Good People. He concludes that suffering is not punishment from a cruel God. He used to believe that, he said, but he doesn't believe the same thing anymore. Since he's grown up, he doesn't even believe the same when he was a theology student. And of course, you know his own family situation. He dealt with suffering in a child. But he said, I now recognize God's limitations. He says God is limited in what he can do by laws of nature and by the evolution of human nature and the human moral freedom that we're still working to get past some of our wars and rumors of wars. He says, I no longer hold God responsible for illnesses, accidents, and natural disasters because I realize that I gain little and I lose so much when I blame God for those things. I can worship a God who hates suffering. Can you believe that? That God hates suffering? I believe from a Christian perspective we saw that in Jesus, that he hated suffering. But in this case, he says God cannot eliminate it more easily than I can worship a God, he says, who chooses to make children suffer or die for whatever exalted reason that might be. He doesn't believe that. Some years ago, when the death of God theory was a fad, he says, I remember seeing a bumper sticker that read, my God is not dead, sorry about yours. He said his bumper sticker would read, my God is not cruel, sorry about yours. God does not cause our misfortunes. Some of them are caused by bad luck, caused by bad people. Some are simply an inevitable consequences of being human and being mortal, living in a world of inflexible natural laws. And finally, he says, the painful thing that happens to us are not punishments for our misbehavior, nor are they any part of some grand design on God's part. Because our tragedy is not God's will, we need not feel hurt or betrayed by God when tragedy strikes. We can turn to him for help in overcoming it, precisely because we can tell ourselves that God is outraged by it as we are. And then this concluding thought. A sense of meaning makes pain more bearable. Does that mean that my suffering has no meaning? He's asked. He said that is the most significant challenge that can be offered to the point of view that he is advocating in his book, he says. We could barely bear nearly any pain or disappointment if we thought there was a reason behind it, a purpose to it. But even a lesser burden becomes too much for us if we feel it makes no sense. He talks about patience. Here's the last thought. We could bear any burden if we thought there was meaning to what we were doing. The last phrase that's emboldened is what I want to get to. But we can give meaning to our tragedies in life. We can redeem these tragedies from senselessness by imposing meaning on them. And he says for us to look to the future redeems our tragedies. The question we should be asking is not, why did this happen to me, or why did I deserve this? That is really an unanswerable, pointless question. The better question is, now that this has happened to me, what am I going to do about it? And y'all know the quotes, so I don't need to quote Viktor Frankl's wonderful quotes about meaning. And he's saying that when we suffer, suffering really is happening because if we have lack of meaning and purpose in our life. And Ralph Waldo Emerson, in your handout, you can read that. He has a very lovely little thing he says about little things that you and I can do in life that give meaning to life for all of us. Okay, are there any questions? Any questions anybody would have. Any statements you want to have about suffering and that you've experienced in your own life or others? And what do you think? Yes, sir.